Welcome back to San Antonio Living. You know, having a family is one of life's best gifts, though sometimes things can get in the way, like your health, that can put your chance at having children at risk. Well, we have a solution from Advanced Fertility Center. Take a look. And we're back at the Advanced Fertility Center talking to our dear friend, Dr. Joe Garza, and he has some more information for us that'll actually benefit men and women both. How are you?
Well, welcome back. Yeah, and with the new developments in infertility, particularly vitrification, which is a very fast, rapid way of freezing eggs or sperm, a patient that has been given the diagnosis of cancer can opt to preserve her eggs and then utilize them later on once she and her oncologist or cancer specialist are happy that she's survived her primary cancer. You can take the eggs, harvest them, freeze them, unfertilized, and then utilize them when it's safe for her to have a pregnancy and a baby.
Now, can you tell me, why does cancer affect somebody's fertility?
Well, depending on the cancer, the oncologist may recommend radiation treatments or chemotherapy or even surgery, and that can damage or ruin or even remove the ovaries or the eggs. So if you can do this beforehand, it gives that patient, that woman, the peace of mind that she has the potential of having her family once her survival is guaranteed. If the oncologist and the patient feel it's safe, then we stimulate the patient very quickly, retrieve the eggs, and freeze them very rapidly that day in a new process that's called vitrification. And you bypass freezing and forming ice crystals in the egg, and they go to a sort of a gelatinous or glassy state, and they're good in liquid nitrogen until the patient's clear to have a baby.
So you're saying until they're clear to have a baby, but I guess how long can we keep an egg frozen?
Well, we have cases of frozen embryos and eggs up to 15, 20 years.
Wow.
So human sperm have been frozen and kept frozen for over 50 years because they're a simpler process. But it's sort of like taking an aircraft flight. The difficult parts and the dangerous parts are taking off and landing, freezing and unfreezing. So in between, it could be quite a while.
Is cancer the only sickness that would harm somebody's fertility?
Well, no. There's lupus or diseases that can affect the body and attack the body. There's some patients that have a family history of premature menopause where ladies go into menopause in their early 30s, maybe in their 20s. So if you want to preserve the eggs, then you can retrieve them, and they're safe in liquid nitrogen in the laboratory until she's ready to have her baby.
Now, would you recommend to everybody who might have one of these conditions to get this done?
At least discuss it with your oncologist. Okay. And then if they think it's safe, that you have that window of time to give us about 3 to 4 weeks, maybe 5 weeks, then we can retrieve them, and then you decide when and if you're ready.
Now, if you want to ensure that a family is in your future, I would call Advanced Fertility Center, and they're located at 18707 Hardy Oak Boulevard, Suite 500. Of course, check them out online at advancedfertilitycenter.org, or just give them a call. The number is there on your screen at 210-616-0680.